Dr. Bill Adams here, and this is another edition of No Spin Live special edition. We have our three international experts. These guys, have been actually, not going to pat anybody in the back, but these guys have been right on target for at least 7 weeks. So I congratulate you guys. We got Dr. Charles Randquist from Stockholm, Sweden, Dr. Dave Sieber from San Francisco, California, and last but not least, Dr. Tom Wiener from Houston, Texas. How you guys doing?
Very well. The hummingbirds are out and feeding this morning.
Well, listen, like I said, we've been talking about this for 6 or 7 weeks. You guys have really focused on the science and data, and it's always interesting that when you basically let the science and data guide you, you usually come out on top, and you use the correct information to base decisions off of, and that's what you guys have talked about. So I think there's some interesting things that we can start with. Tom, I'm going to start with you. And there was a CDC report that came out about 3 days ago. A lot of really interesting information. Quite incredible to me that actually the mainstream media has not even reported on this yet. So not sure why that is. Maybe you have some thoughts, but tell us about this and let's go from there.
Well, it's interesting, and I think we do deserve a pat on the back. We were correct in our analysis from the very beginning when the so-called experts, including infectious disease, epidemiology, and other physicians and researchers, were caught up in the hysteria, and that is the number one thing that somehow needs to be fixed in a future pandemic. This CDC, this is from the Center for Disease Control. This is a critical evaluation. They developed 5 scenarios of the case fatality rate, and the overall cases. The 5th scenario is what they call their most probable scenario. And this data does not even reflect the impact of social distancing. So this is data minus social distancing, minus any other impact, which is fascinating. So their data shows a 35% asymptomatic rate. So in other words, 35% of people who have the virus are asymptomatic. Now their case mortality rate, now this is it's important to understand overall versus case. 0.4% mortality rate of those people who are actually symptomatic with the virus. Not everyone with the virus, those are the symptomatic. So if you add in the asymptomatic patients, the ones walking around that are not sick, that are they just have the virus until it goes away, it's going to drop it to 0.1% or less. We were talking about before we started that, and this is something I mentioned a few episodes ago, my estimate is going to probably be a 0.05% overall mortality rate in the future. The interest in that most probable scenario, the 5th scenario for the CDC, they went through some specific age groups and other information. For 65 years old and older, the symptomatic mortality is 1.3%. So this is not killing 20-30% of people. For 49 years old and younger, the case mortality rate is already 0.05%. It is less than the flu. It's less than the seasonal flu. The R0, which is the infectivity rate, based on the asymptomatic rate, they're calling it 2.5. I'm not convinced by that number. I think it's probably less. The flu averages about just under 1%, under an R0 of 1, and I think that the flu R0 may actually be underestimated. 3.4% of symptomatic cases become hospitalized. All right, and that's symptomatic, not total. And the latency, in other words, when you get the virus until you actually start showing symptoms, 6 days. On average.
So Tom, I think there's some important information you just talked about. So I just want to make sure that people understand the kind of vitamins of that. So basically, you said that the CDC came out 0.4%. That's what we call the case fatality rate. So the case fatality rate is the symptomatic patients and how many of those symptomatic patients died. But then people talk about the infection fatality rate, and an infection fatality rate is everybody that's been exposed to that, including asymptomatic patients or patients that have some other unknown reason to have immunity to the disease that have been exposed to it, in the death rate. And so, is that correct?
That's correct. And the CDC did not release the IFR, the infection fatality rate. They just released the case fatality rate.
And I think the reason is we don't know how many people actually had it, and that's starting to come out. Now, I want you to follow up on this next question. So, for example, you report the very first one of special edition that we did, you talked about the Diamond Princess ship. So that it was really this infection fatality rate, which was they tested everybody on that ship. So I think they had pretty sound data, but it was basically right at 1% or 0.9% at the time, I think, of deaths. And now that's higher than what you're talking about. And also with that, people will hear this and say, well, look at New York City or Northern Italy, and that data can't be right because there's so many more people that died. So what do you say to those people?
Well, the Diamond Princess, the reason it was a higher mortality rate was for the exact reason that New York got hit so hard and became a hotspot. It was a higher risk group on that ship. That ship was a contained environment, close contact, and an older age group. The very numbers I just told you that had a higher fatality rate. In New York City, here these are some numbers. So just to show how bad and good it was, the high point for new cases, the day that had the most new cases was April 14th. There was 11,500 cases. On May 22nd, there were 1,700 new cases. Now, a case is a apparently tested positive case, although remember that the methodology changed, so these are also include probable cases, not necessarily cases that are test positive. They are suspected cases. The high point for deaths was on May the 5th. There were actually, two spikes for deaths. April 13th, there were 778 deaths that day. May the 5th, there were 952. It was a single unusual spike. I have the feeling it was a reporting issue because they got some data in late from hospitals that had been sitting around. On May the 22nd, there were 87 deaths. It's down tremendously, and obviously there is no vaccine. This is an issue that some of the very highest risk have died. And also, even though we're not at herd immunity by any means, there is a factor of people already having the virus and already developing some immunity, which the data does show that there is an issue with developing immunity. I pulled this data up this morning. The comorbidities out of the total deaths and the total cases, the number one is hypertension. Number two is diabetes. Number three is hyperlipidemia, like high triglycerides, high cholesterol. The fourth is dementia. Some of those are heading toward the older age group. So the interesting thing as far as age breakdown in New York City that you don't really hear about in the news, 85% of the deaths in New York State were over 60 years old. 85%. 66% of the deaths were over 70 years old. I mean, this is a huge fraction. It was the majority of the deaths are in a much older age group. The issue that we've seen in the news about moving the governor of New York, Cuomo, moved some of these hospitalized COVID patients into nursing homes was the worst possible decision that you can make. You are putting a COVID patient into the absolute highest risk population. And we're wondering why they had so many deaths. Now, we have already discussed in the previous episodes that why it became a hotspot because of the geography, because of the travel from China and all of that. New York got hit hard, and they did get hit hard. They got a bunch of deaths. The healthcare workers were just beaten up. But there are identifiable reasons, and these reasons are are really important.
And you guys talked about this over the course of this series, that it's a number of things, three main things: population density, viral load, and then other factors. So those would be host factors, age, smoking, comorbidities, and also environmental factors like pollution, things like that predispose. So you guys have talked about this for many weeks, and that's what we're finding out. Now, Charles, I want to go to you. We first started this, Sweden has taken a very different approach, I think a very calculated and science-based approach. It was almost heresy, when we first started this. People were, we had colleagues of ours, Charles, telling us on a chat, like, well, don't belittle this disease, telling us that we shouldn't even talk about it. So you've detailed this for us, and people are still throwing stones at Sweden for their approach. So, but you're there, the deal, and so tell us how things are in Sweden now.
We haven't seen the end of this, and I do believe that governments, politicians will try to justify the way they've been acting, but I'm pretty sure that we will see a lot of legal actions towards these governments who've done this, because it's definitely not been in the name of democracy, and it's definitely not following legal ruling in a democracy. And this is where I think Sweden has acted very cautious, listening to academics, advising people based on knowledge, but not ruling people. A big difference to the rest of the world. So we haven't seen the end of this yet, but it's interesting to see what's happening right now. And I'll give you some interesting data. But for instance, today, Cyprus opened up for tourism, except for Swedes. Swedes are not allowed to go to Cyprus because we're like, I don't know, that black swan, that's not allowed. It's like we are hosting the plague in our country. And I'll give you some interesting data and looking at risk of death and what's actually happening. So I have some colleagues, we're discussing this internationally, and I've got some very dear friends from Canada. And they're extremely upset, like a lot of people are. You can see on the television news about demonstrations in Spain. Initially, they were supposed to open up at the 5th of July. Now it's the 1st of July. Even in Germany, who are very strict, they're not riots, but the demonstrations about questioning democracy. What are you doing? Where's the knowledge, the science behind all these penalties, even jail sentences? So I have these discussions with my friends, and he told me, listen, Charles, I'm 60, and he's from British Columbia, and the risk of death in British Columbia is 7.2 in 1,000. Now, and this is referred to data, of course. So we start looking at Sweden. And Sweden has a population of 10.23 million people. And the death rate this Friday, because over the weekend, it's not that easy to collect data. As of Friday, we had 3,925 cases died in Sweden. And by the way, this was reported in New York Times and CNN, and they screamed out, the Swedish experiment is a human sacrifice, and all these kind of things we've been hearing for the last couple of months. But let's look at the data. Now the question, like Tom said, and you referred to, how many of these ones were above 70? Well, I'll tell you this, 463 were 69 or younger. So basically, 1/6 were younger than 70. The rest were above 70 years of age. 50% of those ones, which is a big failure, died in the nursing homes. Do you know what the average life expectancy is in those nursing homes, which are last stage homes? 3 months. 3 months. And this is data. So the risk for my 60-year-old friend of Canada, if he would live in Sweden, and he's less than 70 because he's 60, would be 463 in 10 million 230,000 people, which is like 0.00045, basically 1 in 22,095 people. So even if we would double the number, the risk for him would be 1 in 11,000, even if we would double our number for him as a 60-year-old. And the UN defines any risk less than 1 in 10,000 as a very rare risk. So we're shutting down societies and destroy hard-fought freedom with a very little possibility of death. And that's reality. And when we look at these numbers a little bit closer, what's interesting is that out of those patients beneath 70 years of age, the age group 60 to 69 was 284. So out of 4,000, less than 170 were 60 or less. And the majority of those ones who were above 60 had underlying diseases. Now, why is this important to understand? Because even in Sweden, there's been a fear created around this virus. And I'll tell you, from my heart, today, my mother came and had lunch with us for the first time in 2.5 months. Not because she was restricted by the government, but because of everything in social media. She was scared. And I've been pounding her with data. And you know, I've had a virus. My family has had the virus. So I said, Mom, at least go from your house to our house. So we had this beautiful lunch, beautiful weather. But can you imagine all the fear that has been put into these elder citizens, believing they will all die? And when the World Health Organization goes out and says 4 to 5% of the world population will die of this coronavirus, this is something you can never take back. The fear is already there. And they read the headlines of social media and the news. They don't read science the way we do. So getting back to these numbers, so if my friend in British Columbia, his risk of death this year would be 7.2 in 1,000, and I just pointed out that it's far less in our open society we have in Sweden. Do you think he'll take the risk to live in an open society? Of course. And that's why we need to stop this political nonsense that's going on, because it is nonsense, because it's not evidence-based medicine. It's not based on science. And as part of that, I'm actually, as of 1st of June, starting to participate in a desire of our government to do mass testing. So we are having companies coming in and having their staff tested, looking at what type of groups, work groups are most affected. You remember I told you, it's not healthcare people, it's actually those ones who work with meat that are most affected, some studies showed. So it's extremely important that we keep on with our work collecting data. But once and for all, we need to understand that the numbers that are presented and the fear that's put into our citizens are absurd. And the consequences to our democracy is I'm questioning how the world will react on what's happening right now. So I'm extremely privileged being part of this group of doctors, being able to really tell this is a true story. But still, can you imagine countries are now saying, no, Swedes, you're not welcome. And this is within the European community. And that's the type of fear our politicians have created. Fake news.
That's amazing. And then I think segueing from Charles's comments, Dave, there's been a lot of talk about lockdowns. You were in the first region in the United States that was locked down in March. But there's a lot of talk now. Talk to us a little bit more about, the strategy of lockdown was about protecting the healthcare system from being overrun. So the peak of cases, the surge so-called, which hasn't happened, and there's been no healthcare system except in Northern Italy that's been overrun to date. But are the lockdowns, number one, science-based now? Should they be continued? And number two, talk to us a little bit about can the lockdowns actually cause more deaths? Because I think there people have been talking about that, and even Anthony Fauci, who, you know, we actually commended him very early on because we didn't know, but I think people have kind of, their opinion is that he's been a little bit overboard in terms of recommending people to stay isolated, which I'm not sure is keeping with the science. But he just came out and said that, well, you can't lock down forever. It's going to have more severe consequences. So tell us more about this, Dave.
Yeah, so the whole purpose of the lockdowns, the quarantines, the shelter in place is really to prevent from the hospital systems from being overwhelmed. And the interesting thing is that if you look at all this data, I think New York might have approached being overwhelmed just because they were a hotspot with so many more cases than the rest of the United States. I was talking to my parents the other day. They said that the governor in Illinois built this huge place in Chicago, in McCormick Place, that was never used. They were also talking to a friend in Minneapolis. The mayor there, or the governor, built this brand new state-of-the-art hospital to take care of all these COVID patients, and the hospital was never used. So I think the thinking in the lockdowns was probably correct, but I don't know, because of how the virus behaved, it ended up just not really working out that way. The one thing I want to focus on, though, is a lot of people talk about the lockdowns from preventing spread of disease or, of infectiousness to other people. The way to really look at that is to look at the antibody test results. So when you look at the Santa Clara study that they did here, their infection rate was between 3 and 4%. So 3 to 4% of people had gotten the virus already. Sweden had a test recently, or a report recently. Their the percentage of population with antibodies was 7.3%. A test done in New York actually showed that they were at 12.3%. And they were a city that was locked down, but again, a city that had a huge surge in hotspot cases. And then there was another report recently out of London, and London said that their percent of people who have the antibodies is 17%. So it's interesting because you have these different cities, some who are locked down, Sweden who is not, but there's still this huge variation in the number of people with antibodies. I can talk here about being in San Francisco. I mean, even despite the shelter in place, people are still standing outside bars without masks on. The lockdown is really only as strict as the government imposes, and nowhere in the United States is ever going to be as strict as places like China or other countries where they can actually mandate a lockdown. And then as far as the quarantine goes, there's consequences. And we all know about the economic consequences because all these businesses have shut down. The number of small businesses here in San Francisco, some of them have been here for 20, 30, 40 years, are now closed because they have no revenue. And a lot of these businesses run on a very small margin. The other thing is rates of depression. I know that people being either, if you're alone all the time, I think it causes more depression, and other people, we talked last time, I think in the last episode, about domestic violence, how domestic violence has increased because people are stuck together all the time. It was really interesting because there's a large level 1 trauma center here in a city called Walnut Creek called John Muir. And one of the emergency department physicians there was cited in another news article recently. He said that in the last 4 weeks, he's seen the number of suicide attempts that he typically sees in a year. So, when people say, oh, well, we just need to stay at home, we got to stay at home, it has consequences. And a lot of these consequences are very severe in the long term.
When there's a message from a government who you more or less trust, or from media who you more or less trust, that you're about to get into Armageddon, this is the plague. We are a unique group of people. We're scientists and we're doctors. Most people don't have the same resources as we do to understand the whole picture. what they see is this Armageddon thing. And of course, living under fear, not for 1 week, not for 2 weeks, but for months, creates disharmony. And I do know from colleagues of mine who are working with these type of phone call centers where you can call if you are abused, whether you're a child or woman. I mean, it's not 10 times, it's 20-fold. And this is in Sweden. Because of course, like my mom, who's reading the international news, they think we're doing the wrong thing in Sweden. They think that the rest of the world has to be right and maybe we're wrong. So things are happening even here. So I can just imagine what happens. And like I told in some of the earlier episodes, most of our households are one-man households, and we live in houses. You know, it's not like we're in a dense population in this. I can just imagine the trauma emotionally, psychologically, for those ones who are really deprived of freedom for such a long time in a small space. So, and on top of that, Dave, to add what we spoke about last time, the consequences long-term for the third world when it comes to food, when it comes to medication, when it comes to support, all those children that will die. We are all agreeing on one thing, that the majority of those ones who are dying from this coronavirus, although it's a new novel one, are elder people that do have underlying diseases. And like I just referred to, 50% of those ones who died in our nursing homes, average lifespan was 3 months. Now, it may sound very Darwinistic, and I don't want to come out in that way, but at the same time, we have to look at facts. The consequences of our actions will kill, not thousands, probably a lot more of children in the rest of the world.
Well, Charles, there were just 2 reports that came out recently, and aside from that report, the murder rate in Houston is up 50% compared to last year. Now, the 2 reports that came out, the United Nations, which always has a questionable tilt to it, they said they just announced that the economic impact of coronavirus, the economic impact of the shutdowns is going to kill more people than the virus will kill. That's the United Nations. They said global starvation rates, and we've mentioned these numbers in previous episodes, starvation rates globally will increase by 130 million, not total. They will increase by 130 million over the baseline. 30 million children are going to be at higher risk for starvation deaths. And then they also announced that 80 million children under the age of 1 year old are now at an increased risk of diseases such as diphtheria, measles, and polio because they're not getting the vaccines.
Precisely.
Because everything is shut down.
Yes.
So we said from the very beginning, the first episode, that this thing was a flu that didn't have a vaccine. It's very true. The older population, of course, is always the greatest at-risk population because of their age and also the comorbidities. Now, the reason that massive numbers don't die with a seasonal flu is because that's also the highest vaccination rate age group. We don't have a vaccine right now, but this virus is not killing a massive number of people more than the seasonal virus. This is a flu without a vaccine.
Yeah, that's it, no doubt. And so for every action, there's a reaction, and every decision, there's a consequence. And you guys have talked about this for 7 weeks, It's just, it is incredible to me that the media likes to track, deaths on their phone, and they like to publicize that and put it on social media. But just as you guys are saying, the deaths, let's just talk about death. The deaths amongst children is 1,000 times greater than anything that's going to happen from this virus. And it's just a shame that we just don't have, everything's just covered so biased now, and people, there's a lot of people that just don't get that information. Charles, I'm going to ask you one thing back to, the Swedish strategy, which seems to really have been, I think it's been quite good. And I think the outcomes, speak for themselves. But so what did Anders Tegnell, who I think has been credited with this strategy in Sweden? What did he know that other people didn't know? Everybody else around the world seems to come to a different conclusion, but do you have any insight into that?
Yeah, so one of the things is Anders wrote his thesis on pandemics and lockdowns. And I mean, it's basically, it's the foundation. I mean, he said in a situation like this, it would not help. Now, the second thing is, of course, he comes from an environment which was created by his predecessor in a way that they have made politicians listen to their advice in the past, and they've had a strong voice, and he's been very firm. I mean, it's not like we have not had a lockdown. I mean, this is also one of the things that's a nonsense thing. We haven't had lockdown in this in the way where we have enforced certain things, except we don't want gatherings more than 50 people right now, and the universities, the students of the universities were advised to do their studies back home. But otherwise, there has been a lot of recommendations, you know, like 2 meters away from each other's. If you're sick, stay home from work. And we have a system in Sweden which really helps people, regular workers. They are able to stay home. So what the government enforced was that they could stay home 2 weeks if they had symptoms without having to show any kind of doctor's signature that they are sick. And this is part of our social welfare system. And so it's been able to create a system where disciplined citizens have been trying to follow the guidelines of the government. And that's where Anders has been very, you know, with his co-workers, very persuasive in making people understand from an educational basis. This is why we want you to do this, because if you don't, these are the consequences. And the major consequence was exactly why all the other governments did the lockdowns, not to have the healthcare system overrun. So having someone who's in charge, who has the ear of the politicians, who wrote his thesis about pandemia and lockdowns, of course, has been very powerful. But that in combination with politicians being very humble towards science and what science says, and not letting their egos and the situation create a political situation where they can take advantage of having them show that they are powerful and enforce things to show that they're men of action. So I think it's the Swedish way has worked well. Now, we have to understand Sweden is part of the Nordic countries, and obviously Norway and Finland and Denmark have acted in a different way. And citizens of those countries are now allowed to travel to Cyprus and other countries. Swedes are not. But, you know, when we look at the numbers, when we really look at the numbers and we compare, yes, it's true. By numbers, we have a higher mortality rate per million citizens compared to these countries. But how far ahead are we in our so-called herd or flock immunity? So once again, the way media is doing, like CNN and New York Times did, that Sweden is a huge failure, you know, and human sacrifice. Come on, guys, look at the numbers and data. And that's precisely what Tegnell is saying. They can shout, they can scream, and they can say all these bad things about our nation. But as long as we don't have numbers to compare how many of our citizens are immune and not, we don't know. And when it comes to the numbers Dave was referring to, in Stockholm, most likely the immunity is ranging anything from 10 to 30%. We do not have those numbers, but that's why we're starting now to test. And once again, testing is important, but the importance of the specificity and the sensitivity of the test, these fast tests, are even more important. Otherwise, we get skewed data, and that's even more dangerous. And it doesn't serve the purpose to test until you've got enough people to show that they've had immunity. I mean, to spend a lot of money to test 100 people and only 2 have gone through the virus, it doesn't serve any purpose. So the mass testing, the government has said, we need to start doing these mass testing when it serves a purpose, when we actually do have data, when we have significant data showing what groups, working forces are most affected, so we can do specific decisions based on that. So he's had a big impact, Bill. Absolutely.
Yeah, so and it's interesting because I assume in Sweden the unemployment rate hasn't changed through this whole thing.
So unemployment rate in the same thing that due to this, restaurants, and so we are affected. We are affected. It's not like there are no clubs open, and so of course there all these musical things are not going on because there is a limitation of 50 people. So of course there is, but the government is covering up for these ones so far. So the government is giving billions after billions to support these small companies because, like Dave said, it's so sad. Businesses, family businesses, 30, 40-year-old businesses are going down the drain because they do not have the margin and the banks are not backing them up. So we are affected, but I come back to this. As a nation, we are not psychologically as affected as other nations. That is the important thing. There's a positive concept, and our souls and our spirits are strong.
Yeah, I mean, it's as you guys have said for many weeks, it's the net effect. So it's not just the viral deaths, but it's the other consequences that go around all the strategies that people develop. And so Anders Tegnell, I just found it fascinating that he was strategic enough and science-based enough. But it's not surprising. We've seen that in our specialty on totally different subjects, that if you follow the science and data, you usually come out on top. Okay, well, let's get some final thoughts. Tom, I'll start with you.
The final thought is really, we've done a lot of analysis, but I think we need to get into the situation where we've done very well. We said that this was a flu from the very beginning, and the numbers show it, even though it doesn't even have a vaccine. We've been right about that. A lot of the doctors, a lot of the researchers have gotten caught up in the hysteria, and we've seen that, even some of our colleagues. What we need to get involved in now is, what do we do for a future pandemic? This one is, there will be some short-term spikes and things as the seasons change. This will eventually become a seasonal type flu, just like the H1N1 swine flu from 2009 did. That was a novel flu. It's now the most common seasonal flu. So moving forward, I think we really need to address, what do we do for a future pandemic? How was this approach that was done here wrong? And I think it was done wrong because it was a shotgun approach. And that shotgun approach took out a lot of people that it didn't need to take out. So what do we do? And this is very short. If an outbreak occurs, we need to identify, number one, where is the outbreak occurring? Number two, identify, is it a possible epidemic or pandemic virus? Number three, identify the virus. Is it a novel virus for which there's no vaccine? Number four, identify the case demographics and the death demographics for the outbreak geography, for the country that it's breaking out. Identify the at-risk group. Now, the at-risk group is, and we'll get to this in just a minute, what the at-risk group is. Number five, geographic isolation if necessary for the outbreak country. Travel shut down from that country, just as was done relatively early on, but there were some back doors from China that didn't get identified. That's to stop the asymptomatic or the minimally symptomatic people from traveling out and spreading the virus. Number six, in the country of origin, isolate the elderly, because the elderly, even when they're vaccinated, they're a higher risk group, and the other at-risk groups, such as diabetes, such as hypertension, that we're identifying now. Number 7, identify a possible vaccine. If there is no vaccine, then begin development immediately on a faster time frame than what has currently been done. And number 8, identify possible antiviral and treatment medications. And that's really a protocol that could have really saved many people going into the future, and also the economies, which has a mortality rate.
All right, good stuff. Dave, what are your final thoughts?
So I'm going to go back to what we always talk about, and that's data and facts. And I think a lot of the government's reactions for various countries, as well as just personal opinions, were due to group thought. And I think we're in an age now where instead of thinking independently, we tend to think more as a group. And we're strongly influenced by our sources of information. And although it's good because we have access to more information, in cases like this, I think it's very detrimental because you just can't sort through it. The other thing is, I think people need to be very detailed in how they go through different news sources, because as you know, all news sources are slanted one way or the other. And for the layperson, I think it's very difficult to kind of sort through a lot of this. But you need to do it because the facts are in there somewhere. It's just a matter of digging them out.
All right, and Charles, you get the final word.
I couldn't agree more than with Dave and Tom, but especially Dave, regarding the mentality during this, like a flock of sheep going to slaughter. I mean, it's surprising that the world has reacted in this way without even questioning what is going on. And that's the problem today with news in general, especially when science is in the back door, it's not allowed in. And when you're questioned and you're won, the mentality today, unfortunately, and that's probably one of the problems in general with democracy, is it's not always the big masses that are right. I mean, as an individual, you can actually be different, but be right, because you have a different level of IP. So once again, I think what's important to bring back science into this. The second thing, and we'll learn a lot of lessons about this, what I think is important, if our intention truly is to protect our elderly, we also need to take care of those ones who take care of our elderly. We can't have the ones who are the least educated, that know the least about hygiene, etc. Take care of them in these situations. So if that is our intention, and that's a good intention, we need to think different, because regardless of this virus or any other type of virus or bacteria or any germs in the world, elder people with underlying diseases will be the ones affected. So I think we need to establish a totally different protocol and education for those people, those ones who are taking care of our moms and our dads, if we really want to protect ourselves. Taking away children from schools, putting a bigger workload on the parents, not being able to go to hospitals or police stations taking care of these elder is definitely not the right way. So hopefully there will be a lot of lessons learned from this, and also in general about our environment, about how we eat food, how we transport animals, and things like that. So hopefully something good will come out of this bad. But I still see we're not over this yet. It's going to be there around us. But I think we need to change the mindset, and most importantly, take away the fear. Take away the fear and show this is the data. Unfortunately, news is not reporting data. That's not where their headlines are today.
Well, that's some fantastic stuff, guys. I congratulate you. You know, your insights about the science and data it's really led the way for that discussion, and hopefully our viewers have enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.